Hi, my name's Emma. I'm here today for removal of my mole that I have just on the side of my face. I've always been quite self-conscious of it because of obviously where it's on my face, and I've heard of this new surgery. It's not going to leave any scarring, so I just thought that it would be a good idea.
Radiosurgery, mole and skin lesion removal is an exciting treatment that I do, utilising radio frequency, radio wave energy. This is a relatively new treatment, but it allows me very precisely to remove any raised skin lesion, almost cell by cell. So I'm going to be just working on this lesion. I'm just going to very carefully mark the lesion out. It's been there a long time. It's slowly growing in size. I've used radiosurgery now to literally remove thousands of skin lesions of various types over the last few years. Predominantly these are simple mole or intradermal nevus lesions, especially on the face. I can use the radiosurgery to treat in very delicate areas such as the eyelids, the lips, the nose, where it would be very difficult to remove a lesion by excision, by cutting them out. But I can also remove larger lesions such as seborrheic keratoses, and these are lesions that are seen usually from the age of 40 onwards that are quite unsightly and can appear anywhere on the body. Simple warts, viral warts and other papillomatous lesions in the skin can all easily be removed. Effectively, any lesion that is raised or raising from the skin can be removed with radiosurgery quite safely. Radiosurgery treatment is really quite simple from the patient's perspective. It's not painful. I use a very small amount of local anaesthetic to freeze the area and the lesion that I'm going to be removing, so the actual treatment is painless. Okay, Emma, so we'll just start the procedure. Hopefully you shouldn't be feeling anything now. I'm just very carefully removing this lesion. Well, this lesion's nearly completely gone. Following the procedure, there's a very small burn on the surface of the skin which heals very quickly. A small scab will form, which usually falls off within the first week, revealing healthy new pink skin underneath where the healing has happened. So a little bit of sun protection as always on the face, okay, but especially over the area that we've treated. And then we'll see you back in clinic in about a month or 6 weeks and make sure that we've got very good healing. Most patients may have seen their GP about these skin lesions, having them removed, perhaps concerned that they may be cancer. I would always offer a very thorough diagnosis of any lesion that I'm going to remove with a technique called dermoscopy, which is a very high magnification of the lesion as used by dermatologists. This gives me the assurance that I'm removing lesions that do not have any cancer potential. The NHS itself will only remove skin lesions where there is a high degree of suspicion that they could be cancerous, and won't remove any lesions now that are just cosmetic in nature, which is the vast majority of skin lesions that I see on a regular basis that people are really keen to have removed. So it's healing very nicely, Emma. I can see there's just a little tiny blemish of healing skin, this pink skin. As I said at the start, it's probably going to take another 3 or 4 weeks for that to eventually fade down and become mature skin. Yeah. And at that point in time, then I think you won't see anything there at all. But it's probably quite easy to, even at this point, cover it with makeup, yeah, if you need to. But yeah, that's healing as I'd expect, and we're getting a nice result there.
I'm very happy. I'll definitely be coming back for more.
Fabulous.